Hello everyone, welcome back to Raaonline Education. I'm Dr. Maheshwaran KS. I'm a lecturer from Department of Prosthodontics, Sri Ramchandra Faculty of Dental Sciences. Today we're going to be discussing an important chapter in relation to fixed partial denture, which is going to be luting cements. This is basically a very dry chapter because it's more of material sciences, but it is very important because this luting cements is going to definitely play a very important role in the longevity of restoration. Okay, so you have to know the dental material part of luting cements for your fixed partial denture treatment plans to become a success. Okay, so the contents is going to include a basic definition followed by introduction to luting cements. Then we're going to see what luting interface means, what film thickness is, what is the acceptable film thickness according to your ADA specification, the requirements of luting agents. We're going to see the classification of luting agents. Then we go into cements used in fixed prosthodontics. You have zinc phosphate, polycarboxylate, GIC, resin modified glass ionomer cement, compomer resin cements, and then you have your zinc oxyreginol and non-agenol cements. Then we go to steps before cementation. For each and every cement, what do you need to do before you start the cementation process? And I will be explaining about the luting protocol for all ceramic restorations alone. Then we conclude this presentation. So coming to definition, what does a cement mean? What does cementation mean? And what is a luting agent? So there's a difference between a cement and a luting agent. Okay, all cements are not luting agents. You need to understand that. Okay, a cement is a substance that hardens to act as a base, liner, filler material or an adhesive to bind devices and prostheses to the tooth structure or to each other, which is according to your Anusavas 11th edition, which is your Phillips. Okay, so cement can be a base, liner or a filler material or an adhesive. It can be anything. It will harden, okay, and it will bind the prostheses to the tooth structure. What is cementation? Cementation is basically the process of doing the cement. Okay, process of cementing an indirect restoration to a crown or an inlay or an onlay or anything. Any indirect restoration, the process of fixing it onto the tooth structure is called your cementation. So attaching a restoration to natural teeth by means of a cement, as simple as that. So what do you mean by a luting agent? The luting agent is any material used to attach or cement indirect restorations to prepared teeth. This is the most important part. So luting agent is basically any indirect restoration. What do you mean by indirect restoration? Basically any restoration that has been prepared outside the mouth. So it can be an inlay, it can be an onlay, it can be a full coverage restoration, a partial coverage restoration, veneers, overlay, etc. So you basically prepare the tooth structure for the particular type of indirect restoration. You make an impression, you pour the model, and the restoration is done indirectly on the cast outside the mouth, and then you cement it onto the tooth structure. So the luting agent that is used to cement or attach the indirect restoration to the prepared teeth will be called the luting agent. So all luting agents are not cements. Please understand that. Okay, luting agent has a specific role. Cement is a more of a generalized term that is used for base, liner, filler as well as an adhesive. Okay. Now, if you come to introduction of luting agents, the long-term success of fixed prosthodontic restoration is influenced by many factors, one of which is selection of the appropriate luting agent. This is what I told you in the beginning itself. You have done an amazing preparation. You have done an excellent indirect restoration. You have fabricated it. It is fitting perfectly. But if you don't know what luting agent to use for that specific scenario, then the clinical success is going to take a hit. Even though you have done all the other things very well, if you don't know which luting agent to choose, if you don't know what is the correct adhesive protocol or what is the correct cementation protocol, then it is immediately going to affect the longevity of your treatment plan. That is why luting agents play a very important role. Okay, so basically if you take types of cementation, you have interim cementation, you have definitive cementation. So sometimes we prefer to cement the processes for a temporary period of time. Okay, where we want to check if the occlusion is correct, or we want to check if the patient has any musculoskeletal pain or any temporomandibular joint pain, commonly seen for full mouth rehabilitation cases, okay, where we want to cement a temporary prosthesis for a long period, not definitively. It is more of a long-term temporary cementation where we still want to retrieve the prosthesis after a period of time. Okay, we are just checking certain things, whether everything is all right or not, whether the occlusion is fine, whether the vertical dimension you have increased is correct or not. To check all those things, sometimes we want to lute a prosthesis only for a small period of time, not indefinitely, where we want to be able to retrieve it. That we call it as interim cementation. Definitive cementation is when you have the final process and your intention is to cement it definitively. You do not want to remove it, or you don't want the prosthesis to get dislodged. That is definitive cementation. Irrespective of whatever type of cementation, the aim of luting agent is basically two. Okay, very important: retention of restoration by filling the gap between the tooth surface and the restoration. So retention, all of us know. Okay, we obviously want the luting agent to be able to retain the restoration in the tooth. Of course, the luting agent cannot do this by its own. You have to do a correct preparation with proper retention and resistance form. Only then the luting agent will be able to fulfill its aim. If your preparation is not correct, even if you use the best luting agent having excellent retentive properties, it will still dislodge. So it's a combination of principles of tooth preparation that is properly being followed, as well as the requirement of your luting agent. Okay, so retention by filling the gap between the tooth surface and restoration, which I'll be explaining in the coming slides. To prevent bacteria and oral fluids from penetration into the prepared surface. That is very important. You need to understand that there is going to be a gap between your, let's say, crown and the prepared tooth. Okay, there is going to be microscopic gap between the two. If you do not fill that gap with a luting agent, it will definitely allow your saliva to slowly seep through this gap, which will carry microorganisms, bacteria, which in turn can cause dislodgement or secondary caries, etc. So you wanted to retain the restoration and you wanted to prevent bacteria and oral fluid from penetrating. So these two aims are very important for a luting agent.